Good morning, everybody. It's a pleasure to be on screen. My name is Bukola Jejeloye. I'm a principal at Skoll Foundation. I work mainly with the climate action team at Skoll. So with that, I will give it to my colleague, Jimmy, to introduce himself.
Good morning, good afternoon, everyone. My name is Jimmy Bruce. Like my friend colleague Nicole, I'm a principal at the Skoll Foundation, leading our racial justice team. Thank you for joining us.
We have the pleasure today of introducing NDN Collective to you. And today we'll be speaking with Nick Tilsen and Michael Johnson. Without much further ado, I want to open it up to Nick and Michael to introduce themselves and introduce NDN Collective to all of us on the screen today.
Dosha Gurugati Sajas, friends. My name is Michael Johnson. I'm a Director of Advancement here with the NDN Collective. I'm a citizen of the 3 affiliated tribes of North Dakota and a relative of White Earth, where my grandfather's from. So happy to be here with you guys today. And I'll pass it over to Nick.
Hamadaki api, Nick Tilsen, Amachi api, Chantea Washtenape Chuzapalo. I greet you in my Lakota language with a warm, heartfelt handshake. My name is Nick Tilsen. I'm founder, president, and CEO of the NDN Collective. I am the Oglala Lakota and a father of 4, and honored to be here today to talk about the work of NDN Collective and kind of these moments in history that we are in right now. So good to be here.
Thank you very much, both. And with that, I will hand it over to Jimmy, please.
Thanks so much, brother. Appreciate it, Bukola. So excited, so happy for you, Nick and Michael. Really see you all, beyond grant partners, but really as friends and allies in the work. And so excited for you to receive this award. The first question is really a twofold question. And the first part of the question, I'll aim towards you, Nick. I want to ask, and I'm sure our audience would like to understand, how does NDN Collective work to challenge philanthropy's traditional approach to grant partnership through an indigenous lens?
It's kind of been our goal from the very get-go, I guess, is and how we do that is, well, one, we're an organization. We're not an intermediary organization. In much ways, we are a movement infrastructure organization that grew out of the front lines of doing this work. So that's the first way in which we're different. We don't exist for the purpose of doing philanthropy. We exist for the purpose of distributing resources and sharing resources throughout Native communities. And so one of the things that we kind of fundamentally challenge about the system of philanthropy altogether is that statistically, a lot of philanthropy has been an epic failure at trying to solve some of the world's biggest problems. And part of what we're saying is that it's because the resources and the decisions being made over those resources are way too far away from the front line or from ground zero where the problems persist at. And so we need to end this whole idea of philanthropy that's like way far away from the issues and the challenges, and we need to shorten that distance, and we need to put money directly into the hands of impacted people. So NDN Collective does that. We believe that in a fundamental belief that we're not here to get philanthropic organizations to behave differently. We're not trying to reform their organizations. Don't call us if you're trying to create new policies. But if you want to distribute wealth and you want to move money and decision-making power out of legacy philanthropic organizations into movement-led organizations that have lived experience in doing the work, then give us a call. That's the business that we're in. We're accountable to our communities and to our people. We organize side by side. And that's the next thing I'll say before I pass this on is I think it's really important for our organization, we continue to be on the front lines. So we're not just funding the front lines, or we're not just hoping just transition work happens. We're doing that work. We're doing that work in where we're headquartered at. We're doing that work, in the territories in which we're from, and it keeps us accountable. It continues to hold up the mirror to who we are, and to recognize what the struggles that facing Indigenous people are. And so that's one of the biggest ways. And so when it comes to philanthropy, we're really getting philanthropy to move not just grants, but move assets. Move assets out of some of these institutions, behave drastically different, and give up the decision-making power over those resources to impacted people, radically different. And so that's why NDN Collective really exists, for the purpose of investing into the self-determination of Indigenous people that are doing the work of defending and developing and decolonizing.
Thanks. Thank you so much, Nick. I wanted to offer Michael you a chance to weigh in on this broader issue. And could you explain to us or identify the different arms of the organization which interact to innovate the power building that you're seeking within Indigenous spaces?
Yeah, thanks for that, Jimmy. And, just to kind of lift up some of the things that Nick was saying, one of the things that NDN's ecosystem was created to do was be a holistic systems disruption of the current lack of resources and technical skills that flow into our Indigenous communities. And so really working through this kind of practitioner-informed program design, we've come up with kind of 4 different distinct bodies of work that we do interventions and empowerment work in our communities. Our first that I wanted to talk about is our NDN Action Team, which is a public education, nonviolent direct action organizing arm of the collective, which focuses on our Land Back campaign, our climate justice campaign, racial equity, and education equity for Indigenous people. We also have our NDN Foundation, which is our grant making arm. Since 2019, we've awarded over $33 million to close to 650 grantees across North America, Indigenous grantees across North America. We have an impact investing arm, the NDN Fund, which works to provide low interest and patient capital for Indigenous entrepreneurs, tribes, and people needing to attract that kind of capital. And then we have a community development or a real estate development arm that is meant to help create real estate assets for the programmatic interventions coming out of the other arms. One of the things I did want to mention, though, is that while we have these different distinct bodies of work, NDN's philosophy and the canon is really focused on increasing access to resources, providing culturally relevant technical assistance and capacity building, and helping Indigenous communities set the agendas on things that are important to them, and redesign a stakeholder table where Indigenous voices can be heard, amplified, and brought into the solutions that we're all working towards. Check.
Thank you very much for that, Michael, and great. Thank you so much for those answers. Moving on, Nick, you especially, you've been no stranger to the news cycle over the past couple of years in your activism for Indigenous values and Indigenous power building. So historically, Indigenous values have not been centered in solutions to climate, economic, education, and racial injustice in this country and globally. NDN Collective and other Native-led organizations have been working to change both the narrative and the actions around this, such as the Land Back movement, which you've been working very much in. Where do you see all of this going in the future? What impact do you envision happening with more of the centering of Indigenous values in creating solutions to these problems that we have globally and in this country? So, Nick, first of all, and I'll get back to Michael after.
Absolutely. Yeah. I mean, I think the first thing is for folks to realize, why we have to take some of the stances we're taking is because the erasure of Indigenous people is persistent and it's accurate. It's it's consistent, and it's we call it erasure because it's happening now. We're not talking about something that happened a long time ago. There's 26 states in the United States who don't teach any American Indian history. That's 26 states in the United States who don't teach any American Indian history. And then we wonder why there's so much, racism and erasure of Indigenous peoples, because they don't see us. So the land back movement, to be clear, wasn't created by a think tank. It was not created by, some messaging campaign or some marketing firm. That the land back movement came from the front lines of those of us who are risking our freedoms, who are risking our lives, taking on some of the biggest corporations and some of the most destructive colonial governments in the world. And in those moments, we talked about what if we had land back, if we controlled our own lands, how would this fight be different? How would the playing field be different? We wouldn't be needing to fight some of these oil companies, these extractive industry companies, because we would be controlling what is happening on our own homelands. And so land back is many things, but it is a war cry for the liberation of Indigenous people and our land. And you cannot start a conversation about social justice or racial justice or climate justice with Indigenous people without talking about land first. So what we're saying with the land back movement is that this is the starting point of the conversation. If you are not going to be able to enter into this conversation without talking about the return of Indigenous lands back into Indigenous hands, then there is no starting point. We're not going to talk about Indigenous and white relations. We're not going to talk about any of those things. We're going to talk about true justice. And so land back is that movement, and it is that narrative. And our hope by, the impact that we're trying to make in the world is by saying exactly what we need and exactly what we're fighting for as Indigenous people. It doesn't allow white supremacy or Zionism or any of these things to be able to erase us and tell us, well, that's not what you really want. Because that's what we're told as Indigenous people over and over. But we're saying, no, we know what we want. And let's have the starting point be the return of our land back to our people. And so I think that is really, really important for folks to understand the intentionality behind that. Because what we have learned throughout history is that if you don't say specifically what you want, the colonial governments and the corporations of the world will water it down and try to make it seem like they're delivering something. And so that's what this is about. And our hope is that this change will change the power structures. This will change the power structures in dealing with Indigenous people. And that's at core, one of the biggest things that we're fighting for.
Thank you so much, Nick. I wanted to ask a question of you and Michael. It's actually something that Michael and I have talked about before over coffee. So he and I know he has some thoughts on this, but I'm curious, since the so-called racial reckoning of 2020, has the visibility and investment in the Native community increased? And along with that, how is NDN Collective and its partners ensuring that Indigenous people in the United States and globally are not being overlooked? And that's for either one of you to start addressing.
I'll take the first swing at it, then Michael can fill in. Yeah, I mean, I think one of the things that we made really clear right off the bat, even when we took the stance that we took at Mount Rushmore in 2020, is that we wanted to stand, after the death of George Floyd, we wanted to stand in solidarity with the Black liberation movement. And we wanted to address anti-Blackness within the Indigenous peoples movement. We also wanted to address erasure politics within the Black liberation movement. And so we wanted to do an action, and we wanted to raise awareness in a way that allows us to be completely authentically and organically Indigenous, while at the same time standing in solidarity. And I think that this strategy has opened up a lot of doors and avenues for conversations and beginning to start efforts around collective liberation. And so I do think that Indigenous people's voices and our story and our values and what we're fighting for has been uplifted more and more. But it's also because we've been really persistent about having a narrative around collective liberation where they cannot invisibilize one group over another, when the very fact that our liberation is bound up with one another. And so I think that it's heading in that direction. My hope is that that it continues to be the new standard, that it's not a fad.
Thanks, Nick. Yeah, anecdotally, I would say that, we saw an increase in resources temporarily over the social reckoning of the last 2 years with the global pandemic and everything happening here in America. I also, really challenge philanthropy not to, kind of go back to business as usual in this regard. I think there was obviously a want and a need for these resources to get into community to help defray some of the pain people were feeling. But it's also, juxtaposed against the fact that most foundation endowments grew by 20% over the last 20 years. And so when we want to talk about what parity in movement investments or parity in community-led institutions look like, I think, the challenge is we still got a long way to go.
Thank you both for those clear answers. I really appreciate it. I think at this stage, I would like to pull up some questions from the audience. I mean, the audience has been really engaged and over as you were speaking, and you'll see it from their chats. I think the first question from the audience I would like to ask both of you is a question on what non-native American folks, non-Indigenous folks can do to support the work and the power, the infrastructure building of Indigenous folks in the US and globally. How can they support Indigenous power building?
Bukola, did you say we or they? Hey. Well, so I'll say one piece. I mean, I think the reality is like, doing land acknowledgements isn't good enough. I think that people have to take to action. If there's not some kind of process in your town or in your city or in your state about returning some piece of land back to Indigenous people, then get on it, because that's not solely Indigenous people's work to do that. People can work with tribal communities to initiate those conversations. The other one is a real big one. I'm sure Michael will talk about resources, but I'll talk about one that I think is one of the biggest threats to unity, and that's white fragility. I think that white fragility is, I think it's a threat to dismantling white supremacy. And I think that what we're trying to do is abolish systems of white supremacy that have been in place that perpetuate these problems in society today. And it happens to be that whenever Indigenous people rise up and say exactly what we think, exactly what we want, and exactly what we're fighting for, and we've seen this in the land back movement, is that sometimes it creates fear amongst non-Indigenous people, particularly white people, who become fearful of that. And I don't know how much more is to say it, that the white fragility and addressing the fragility of white people as we fight for liberation is not an issue that Indigenous people need to lead up taking. That is an issue that white folks can really be in solidarity with us by addressing that and by organizing themselves around that to eliminate that, because as we tear down these systems, there is going to be need for deep collaboration to abolish these systems together and to move things like land back forward, move things like racial justice forward. And so having an emphasis and a focus on how how you all address white fragility is really important. And that's something you all can do. You don't have to wait for Indigenous people, our people of color, to lead those conversations.
Thanks, Nick. Yeah, obviously we need resources. I mean, Indigenous people have been redlined out of economic activities. We've been allowed to play in sin economies like gaming or, tobacco and things like that. But it's left us with mono economies in our community. And so as we look to diversify into the future and build new systems for our kids, resources become really important to the way that we're able to develop those strategies and those systems. One of the things I wanted to pick up on what Nick was saying around white fragility is I see the other side of the coin too, and think about all of our great allies and the white privilege that they may be endowed with. And I think about how when there's not Indigenous people in the room, what a great flex of privilege it may be to address white silence around these issues and these racial issues and things that have happened in this country. So, I always ask our allies and people that are fighting for liberation and equity alongside of us to think about how do you hold these messages and challenge them to take our voices into the spaces that we're not and help people find the right conversation here. Check.
But to be clear, don't go into those spaces and speak for us, because we don't need that either. We don't need that either. We need you to hold the door.
I hear you, Nick. I hear you on that thing. Keep it open. This is a question that's percolated in the chat from one of our members, one of our audience members tuning in. Long before the late Gwen Ifill coined the term "missing white woman syndrome," Indigenous women have long been, under threat of violence, sexual violence, other forms of violence, missing, disappeared. There's actually a movement for missing Indigenous women. And as you both well know, Indigenous women face a variety of inequitable outcomes in regards to health, education, economic empowerment. This question is from the chat. How does NDN Collective apply a gender lens to your work, to your programming and advocacy for the benefit of Native women and girls in particular, given the extraordinary inequities they're facing, even in contrast to other women of color?
Well, the one is you can't give lip service to this issue. It has to be into the every DNA of who your organization is. And so, NDN Collective as a 70% Indigenous woman organization, and many who are matriarchs amongst their people and their communities, is one, it's right into the DNA. You got to create opportunities where Indigenous women are being able to resource and support other Indigenous women in the fight for justice and visibility. And so one is it's baked into the actual DNA of the organization in that way. And I would say if it wasn't, then we would be off point. I think the other thing is that these issues are compounded and complex. There's a lot of data that shows the relationship between extractive-based economies in the fossil fuel industry and the epidemic of missing and murdered Indigenous women and people, that there's a direct correlation between these fossil fuel industries and extractive industries and pipelines and these things and this issue. And so it further, reminds us how much bound up the issue of murdered and missing Indigenous women and the issue of extractive industries are bound up with one another. And so I think that one of the big things is you got to support Indigenous women that are leading the work in dismantling some of these extractive-based industries, and not just support just the issue by itself of murdering and missing Indigenous women, but support Indigenous women who are leading work through a variety of different fields in that way. And so those are some of the ways in which One, it's baked into the DNA of NDN Collective. One, how we're supporting and resourcing a lot of Indigenous women and leading much of that work.
Thank you very much, Nick, and thank you very much, Michael. I'm looking at our time. I know that time is going, and there are still so many questions from the audience. But I want to give both of you the chance to have the last word in this conversation before we get yanked off here. So I want to open it up, starting with you, Michael, to give us your last words and summary on the work in which NDN is doing now and the future, what you see as the future, and get the same similar answer or the same question to Nick to round us up for today. And to our audience members who had questions and that were not answered, we will be sure to send them on to NDN Collective and find some way to relay the answers to the general audience following this. So Michael, on to you. Thank you.
Thank you, Bukola. I wanted to kind of go back to one of the things Nick was saying during the when we were talking about land back there earlier. Some of these issues and the organizing that we're doing really focus on keystone issues or waterfall moments, right? And so when we think about land back as it relates to climate justice or continued fossil fuel exploitation in our lands, or how it relates to our missing and murdered Indigenous relatives, we see that some of these issues have a positive downstream effect on some of these other societal issues when we can address them right. And for us, I think part of the big rally cry really comes down to this idea that when we can address these keystone issues, it'll lead to societal, economic, and cultural revitalization in our communities. And, part of NDN's premise is we really believe when you invest in Indigenous innovation through our cultures and our traditions and, our hyper place-based understandings of the geographies that we're in, our people have solutions to the problems that are facing all humans on Earth right now. And we look forward to helping contribute to equity and justice for all. Check.
Thank you, Nick.
And I'll just end by saying, it's important that people see that both those of us that are on the front line are also some of the same folks building long-term solutions, and don't try to separate those things. Deal with us on the front line, deal with us in Washington, D.C., and deal with us in the community work and development work that we're doing. Because, it was once said in some race stuff that happened in Rapid City recently, and they asked us, they said they couldn't tell the difference between good Indians and bad Indians. And the reality is we are both, because we're fighting for the change that we're seeking for our people while building the communities of tomorrow. And we actually do believe that the best days of our people are in front of us and not behind us.
Thank you so much, Michael and Nick, and it's a pleasure to have you as part of the Skoll family going forward. We're looking forward to the great work you're going to be doing in the future. Jimmy, any last?
No, I just want to thank our audience. I mean, the activity in the chat is extraordinary and inspiring, and wish we had more time for you all to engage with these two remarkable men. As Bukola notes, there will be opportunity to percolate those questions to them for response, and just thank you for joining and encourage you all to learn more about NDN Collective, not only through the links that we put in the chat, but also through your own searches online. Thanks, Bukola.
All right, and I'm going to transition us now to a conversation with Angela Gichaga and the team at the Financing Alliance for Health. I want to welcome Angela, who heads up the Financing Alliance, and Nellie Wakama, Country Engagement Director, and Joyce Kabiru, Country Engagement and Investment Manager at the Financing Alliance. Hi, team. Welcome.
Hey, Catherine. Hi, everyone.
Yes, and of course, Aziza Buka as well, who heads up Partnerships and Resource Mobilization. Hi, Aziza. So happy to see you. And my name is Catherine Spencer. I'm on the investments team at the Skoll Foundation. I had the privilege of working really closely with this amazing team last year as we at Skoll learned more about their work. So Angela, congratulations, first of all, and thank you so much for joining us. I want to jump right in and ask you, why the focus on community health? Why has the Financing Alliance chosen to tackle community health? And then why the focus on financing specifically? Why is financing a missing link as we think about streamlined and scaled community health programs?
Thank you, Catherine, and it's an honor for us to be here. The burden of disease across the continent is largely preventable, and we know that health services are under-accessed and underutilized. We see it in our households, in our communities, and even with the people around us. Providing health services at the point of need, close to the household, through community health systems, is what will reduce the costs that an already overburdened health system at facility level is experiencing. There's a strong case for investment in community health systems. We've seen it in the different countries we've served. On average, across sub-Saharan Africa, there's a 10-to-1 return on investment case in terms of the economic investment case. That means for every dollar that we invest, on average, we can reap about $10 in return. And it's not just about the economic investment case. We have seen the health impacts that strong community health systems that are linked to primary health care facilities have in various countries. And we've also seen the women and youth and empowerment that has happened across the continent through the opportunities that are provided through community health services. But the truth is, despite the very strong investment case, community health systems across the continent are underfunded. There's a $4.4 billion annual funding gap for at-scale community health systems on the continent. And when we talk to governments, every government that we serve, financing is highlighted as one of the top bottlenecks that they face to taking these very impactful systems to scale. Not only is there very limited money within the system, but in addition to that, the little money that's in the system that funds community health systems is very fragmented. What does that mean? The money is then earmarked and streamlined and focused on specific disease areas and or specific parts of the system, which then don't build a full system that can actually deliver services. This fragmentation causes massive inefficiencies within the system. Our team supports governments across the entire community health financing value chain. We have a bottom-up approach where we embed team members to support securing domestic funding through budget lines. But then at the end of the day, in as much as domestic budget lines are very significant to sustainability, the truth is we'll never fill the funding gap just by domestic resources. The big portion of funding on the continent does come from regional and global funds. So we complement our bottom-up approach with our top-down approach, where we are co-shaping and working with different global funders in terms of streamlining how funding comes for community health systems on the continent. FAH has engaged about 15 governments thus far. And as we look to our next strategy between 2023 and 2027, we're looking forward to doubling down on closing this massive funding gap across the continent, even as we expand into new geographies and support new countries and respond to their requests through initiatives such as the Africa Frontline First initiative. Back to you, Catherine.
Thanks for that, Angela. You know, in getting to know you over the last several months and how you are as a leader, Angela, and even how you think about the work of the Financing Alliance and the sort of the role that it fills within the broader system, collaboration is a really clear theme. So I think it's fitting that we have representation across your team at the Financing Alliance today to speak to specific areas of the work. So with that in mind, I'd like to invite Nellie into the conversation. And, you know, Angela, you just talked a little bit about the sort of marriage of the bottom up and the top down approaches. And Nellie, I wonder if you could talk to us about that bottom up piece and sort of double click there. We saw a bit of it in the short film this morning, but what does that look like to actually engage with governments? What does that look like in practice? Talk to us about that piece of the work, if you would.
Yeah. Great. Thank you so much, Catherine. Governments are the custodians of public health systems. And so what this means is that if we are to achieve universal health coverage, making sure we don't leave anyone behind, then governments must take the lead in implementing community health systems at scale. So what then that means is that the bottom-up approach, we are embedding capacity as the financing alliance for health within ministries of health and ministries of finance to really, first of all, make sure that there is no bottlenecks in terms of financing at the country level, because these two ministries need to work together, and that some of the bottlenecks really come from that false dichotomy. The second thing is that when we are doing the bottom-up approach and embedded, there is the skills transfer, and that makes it sustainable. Because when we learn from our government colleagues, we also transfer our skills. They are able to budget, they are able to do their costing, they are able to, develop their community health policies and strategic plans, which are very foundational to securing budget lines. So with our embedment approach, then we work with governments and support them in creating these fundamental tools. That starts all the way from catalyzing political will, which is very fundamental, and then creating community health, co-developing community health policies and costed implementation plans. Even at a personal level, if you want to finance something, you need to budget for it, you need to plan for it, and that is how government works. So we support these countries with their budget process and also in understanding their specific budget cycle. And that's the pathway to creating budget lines in these countries. And with these tools and with the knowledge that we are able to transfer, then we are able to catalyze some domestic resources for these programs. That way, countries have skin in the game, governments have skin in the game, but then we are also cognizant that this is not enough. And that is why then we have my colleague Joyce, who is working on the top-down piece under the Africa Frontline First initiative. Over to you, Katrin.
Well, that was the perfect segue. That's exactly right. So meanwhile, to sort of complement that in-country work with ministries of health and finance, you're also doing this advocacy work, right? Advocating for the prioritization of community health and for more effective funding at a regional and even at a global level. So Joyce, please hop in. I'd love for you to share a little bit about, how that country engagement work is complemented by this higher level sort of top-down piece of the puzzle as well.
Thank you so much for that, Catherine, and thank you for the segue, Nelly. So country work has been quite critical in the design of the Africa Frontline First initiative. So the Africa Frontline First, or the AFF as we call it, is a collaborative initiative between our Financing Alliance for Health and some of our true partners, including Last Mile Health, Community Health Impact Coalition, and Community Health Accelerator Partnership, working under the championship of Her Excellency Ellen Johnson-Sirleaf. The work that we're doing really is geared towards deploying an integrated community health workforce of 200,000 community health workers across 10 countries by 2030. We work across a number of areas, including designing and deploying financing mechanisms, sustainable financing mechanisms, fostering country leadership in the design, implementation of sustainable financing for community health, and lastly, cultivating political will at country, regional, and global levels. The work that we have done at country level really has provided us the really good vantage point of what governments need. And when we talk about what government needs, it's across different areas. What are the areas that need investment? What level of investment is required? And lastly, what is the best way in which this funding should be deployed in countries? And we take these insights and share them with our global funders. And the reason for this is because we want to ensure that funding arrives in countries in ways that are really meaningful and can actually be able to support governments to reach their objectives for community health. Some of the things that we are advising our government partners as well as our global level partners are around a number of areas that are quite aligned to the AFF principles. This include one, integration of funding, and Angela spoke to this. A lot of the funding that's deployed in countries is centered around specific diseases. However, at the country level, we find that community health workers are providing services beyond specific disease. They're providing integrated services. And so for us to be able to make sure that this funding is actually able to support community health workers to provide a spectrum of services, there is need for increased coordination at source. And so we do speak to our global funders and share this insight to them and say, it could work better and be optimal if this funding was deployed in a more integrated fashion. We also advise for development and design of different types of financing mechanisms. We find that for us to move towards sustainability, it's going to be important for us to think beyond traditional grant funding for community health. Lastly, we also advise around providing support to government-led programs. Oftentimes we find that on the ground, there are parallel systems of funding. And this really does duplicate efforts and also fragments the amount of funding that's available to countries. And so we ask them, is there an opportunity to pool resources, either physically or virtually, to support governments, and with this increasing the level of investment that's available for community health, and also providing an opportunity for optimal and also funding that's able to really support government to address its priorities. So from the work that we're doing, our hope is really that we can be able to support countries to move towards long-term sustainable funding. But then this funding is also going to be complemented by increased government support to community health. We really hope that we can be able to support in closing the financing gap for community health. From analysis that we have done at Financial Alliance for Health, and with support from partners, we've identified a $4.4 billion funding gap, annual funding gap for community health in Africa. The work that we're doing really is around deploying about $3 billion US dollars by 2030. And so we really see this as a way to start catalyzing new level of investment into community health. Prioritization of community health is very important. Without prioritization, it's going to be very difficult to have funding flow to that specific area. We have seen increased prioritization in the wake of the pandemic, and we are seeing global funders starting to see community health as a way in which you can be able to protect health systems from future pandemics. And so the work that we're doing really is around building a momentum of community health champions, community health, bringing new funders on board, and also putting communities at the heart of the work that we do. And so we hope to really bring on board and bring together governments, philanthropies, multilateral, bilateral funders, politicians, communities, because it is our collective responsibility to start to bridge the gap in community health financing.
Thank you so much for that clear articulation of these different pieces of your work. I want to ask one final question, and then I'll turn it over to some of the questions coming in from the audience. So folks, please enter those into the chat, and we'll get to those in just a minute. But before we do so, Angela, maybe this is back to you, but would love to just hear, why is this an exciting moment for the Financing Alliance? I think Joyce's answer started to get to some of this and some of the exciting things you have on the horizon, but why is right now an exciting moment for your organization?
It's really an exciting time for us at the Financing Alliance, not just for us as an individual organization, but also for the organizations that we partner with and work collaboratively with. We're developing our next strategy, the 2023 to 2027. There's so many lessons learned from our inaugural strategy, and we are looking forward to really focusing and doubling down on closing the funding gap that Joyce has articulated, even as we incorporate the learnings from our previous strategy. And if I could just summarize what we're thinking about in our new 2023 to 2027 strategy in 4 priority areas. The first area is strategic leadership and sustainability. The second is the Africa Frontline First initiative. It's an audacious, ambitious goal. We plan to do it together with people on this call and also within the ecosystem that we are working with. The third is programmatic expansion. We continue to receive additional requests from new countries, and we need to also be responding to that. And the fourth is government and institutional capacity. So I'll start with the strategic leadership and sustainability. We are finalizing our 2023 to 2027 strategy and figuring out who do we need to be walking this journey with. We're looking to onboard a head of policy, a head of partnerships development and advocacy, who will help us identify who are those strategic partners. Joyce referred to, it's going to be multiple stakeholders across the entire sector, health and finance and other line areas. It's going to be public and private sectors. And so we do need this guidance and support in figuring out when, how, and how do we bring all these different actors together, and how do we actually tap into all these types of funding and stack them for country use. The Africa Frontline First will be front and center in our new strategy. We have pulled together a secretariat across the collaborative organizations that Joyce referred to, fully dedicated day to day to see us get to the goal of 200,000 institutionalized community health workers across 10 countries by 2030. The Secretariat will be working full-time, and we are looking to bring in the right skill sets and additional partners and people to work with us in that journey. We have different phases of implementation of the Africa Frontline First, and we are looking to pull together resources for the Scale Up Fund. It's an ambitious goal. Over the 10 years, we're looking to bring $2 to $3 billion into the system in a way that it can actually be utilized by the system. And we recognize that that was going to take a number of conversations and a lot of partnership within the space. Programmatic expansion has been the mainstay and the foundation of our work so far. We've learned so much from our governments. We've seen what works. We've brought our life experience and then been able to co-shape policies. And we look forward to responding to more and additional governments as they ask for our requests in collaboration with other partners. So geographical expansion will continue to be a part of our work, but now we'll be focusing on providing the financing solutions to the countries after articulating the funding gaps within those particular countries. We are 5 years old, Catherine, and it's been a wonderful journey. We started as under fiscal sponsorship, and as we speak right now, we have 2 entities, one in the US and another one here in Kenya. And the truth is we need to build our institutional capacity and governance. Our financial systems and our legal systems need to be strengthened. We've already started that process, but we also realize that in our new strategy, the idea of actually entrenching these systems, procedures will be very key for us, an organization, to be sustainable so that we can be able to support the governments in thinking through their long-term strategic plans. We are also going to put a lot of insights into the space, as we have done in the past, so that even the countries that we're not able to embed team members in will have resources that they can use, either through our curricula, either through the community health financing aim tool that will then map out a roadmap for sustainable mix of funding for different archetypes of countries. We are hoping to continue providing insights in collaboration with our partners to the system that can be utilized across multiple countries on the continent.
Well, there's a lot of great activity in the chat, and I'd invite folks to continue submitting your questions. There's one in here, team, about one of the themes that you touched on earlier, which is that transition or that evolution from sort of disease-specific funding to a more integrated and horizontal approach to global health. And I wonder if you have more to say about that, whether you're seeing donors sort of shifting to that more general approach, and in so doing, if that's successfully sort of like shifting power to local communities. What do you think about that landscape of that shift in the space?
It's an interesting phenomenon to observe, especially post-pandemic. The truth is we have individuals who then suffer multiple illnesses. There was a time where there was need to really truly move the needle in particular disease areas, but the truth is what the pandemic has shown us and what patients have shown us. If you map a patient journey, a patient might start with a flu and a cold, and then later on have diabetes, and then later on have another ailment. This same patient requires to be able to engage the health system and be able to be served by that health system. We have a strong platform in the communities that we can activate and have been activated in the past to provide these services. It's unfortunate that a community health worker can go to a household and only have either equipment or medicines for only one disease area, and they go there and they have this equipment and medicine for one disease area, and they find that maybe that household doesn't need that particular disease intervention, but there's a child in that household that's there rearing. There's a woman who's just given birth and she thinks she's actually having excess bleeding, and that particular person who has gone to the household and overcome the barriers of access to healthcare, be it physical or financial, is not actually able to give the insights to that lady or that child because they've only been trained with the blinkers on. The truth is, our patients suffer multiple illnesses and at different times, and we need to equip the health system, both from the primary health facility level to the community, to be able to deal with those multiple ailments. And when there are complications, that community health worker is able to identify the danger signs and actually refer those patients to the health system. Has funding begun to flow in an integrated manner? Yes. Is it sufficient? Not necessarily, but we have seen that post-pandemic, people have seen that this ailment, this one pandemic, was able to retard progress across multiple diseases, even though that wasn't the primary disease. People were not able to access essential health services. We saw a lot of loss of the progress that we had made in so many of the health indicators. We cannot come to invest in systems with the same lens that we've been investing in disease-specific areas. We need to understand that there are efficiencies in building a platform of delivery, so that when you have your focus and you say, I want to actually get my particular intervention to a person, we are making sure that the people who are going to interact at the front line, at the household level, have everything that they need to deliver the services, that those community health workers are compensated, that they have the right training, that they're supervised, they have the equipment, and they have the drugs. Coming into systems strengthening with, I only provide supply chain services, I don't pay salaries, I'm only interested in commodities, or my solution is digital. Right. Digital is an enabler to service delivery. Digital is not the service delivery, right? We need the community health workers to offer that service delivery. So there has been progress in the right direction. It's just, I do think that we continue to learn together to understand that we cannot use the same approaches and the same lens in system strengthening by still coming with, we want to do this one thing and this will be the silver bullet in the system. No, all parts of the system need to be strengthened. We are not saying that one funder has to fund all parts, but it's saying how, as Joyce had mentioned, how do we collaborate and identify, okay, if my intervention and my investment will be digital, who's paying for the supply chain? Who's paying the community health workers? Who's making sure that they are well trained? How are we making sure that all these investments are coinciding and aligned in country at the time that they need, in a manner that is helpful? And that is actually one of the driving forces of the Africa Frontline Fast initiative. We want to be able to support the community health system as a system, recognizing that the health worker is at the center of delivering the service to the community and making sure that that health worker is well supported, even with referral systems to primary healthcare facilities.
I want to zoom out a little bit to the way in which you work as we sort of approach the end of our time together today. Some refer to organizations that are knitting together players across sectors, so civil society, government, private sector, as system orchestrators, right? Dawn said it earlier. What's your experience playing that role as FAH, and what's the importance of working in that collaborative sort of cross-sector way as you think about catalyzing really large scale and bold social change?
Yeah, no, thank you so much for that, Catherine. I think that's really how we do see ourselves. We do see ourselves as system orchestrators. And the reason for this is because, as Nelly mentioned, we do provide technical advisory services. But in the community health systems in which we work, with the governments that we serve, there are multiple actors that are doing very important work across different areas. And so we find governments playing the role of policymaker and financier for community health. We find development partners that are funding community health programs. We find civil society that's advocating for increased budget lines and improved service delivery in community health. We also find communities that are, recipients of services and also do provide a really good voice, an important voice and feedback to the health system, on what their needs are and how the system can be improved. We have NGOs that support government in implementation of community health programs. And so really there are different actors that are serving communities. However, all these different players require resources to be able to play their roles effectively, and that's where we come in. We come in to identify what the needs are for community health. We come in to develop investment cases that speak to the return on investment for community health and which can be used for advocacy efforts. All these different players have their comparative advantage, and so with the different scopes of work that we are delivering as the Financing Alliance for Health, we are able to provide the different evidence that is required and support in providing the different support areas that would be required to properly implement community health programs. And so we see ourselves really as supporting governments and serving as a bridge between these different players and making sure that everyone is at the table. Oftentimes we find that people are working in silos and they're not necessarily speaking to each other. And so the needs that are identified are not holistic. And so investments are made in silos. And so by having everyone sitting around the table with government there present and leading and playing that stewardship role, we are able to make sure that there are holistic solutions for the community health system.
Thank you so much for that, and thank you for this really rich conversation today. We are approaching the end of our session, but any final thoughts, words you'd like to leave us with before I close us out?
Maybe I'll speak on behalf of the team in terms of just saying we are truly honored to be here and to have this recognition of us as a local organization based in the Global South, delivering based on our life experience and global exposure, yes, and our education, but really trying to help our communities and our families. We are super keen on seeing how do we actually make sure that health services are accessible and are utilized, and focusing on what Samantha Power has said, and even Nick in the previous session was talking about. We truly understand what the challenges are, and I want, it would be wonderful for us to continue collaborating with all the players out there, with the Africa Frontline First initiative and many of the other collaborative initiatives that we have to truly advance, making sure that we don't leave anyone behind, but making sure that also the services that we provide are acceptable and also utilized by the communities. And we are really keen on this conversation around Global South-led and collaboration with development and also localization of health. And I want to make a plug here for people to be able to join us on Friday for our ecosystem event, where we're hoping to really advance the conversation around what does localization actually mean? What are the challenges with the narrative that actually exists right now, even as people talk about localization? Are we doing what Samantha Power mentioned? We're saying we want localization, but we want an infrastructure, that then is supposed to be dealing with reporting that takes 360 days out of the 365 days. Is that even a feasible expectation of local organizations? Are we saying that we want local knowledge, but we want global relationships? Where will local entities be able to tap into global relationships to be able to shape those global agendas? So I really welcome the audience to join us on Friday as we continue to unpack. We might not be able to solve localization in global health, but we do need to advance the conversation on localization of global health. Thank you so much for this opportunity and honor.
Thank you so much, Angela, Nelly, Joyce, Aziza. Thanks so much for being with us, and thanks to all of our participants today as well. It's officially day one of the Skoll World Forum. Encourage you to join sessions today and tomorrow. We will see you out there, and happy connecting. Thanks again.
Thank you. Bye. Thank you.